All right, we are halfway through the week and we are tracking the COVID-19 numbers as we always do coming out of the state of Arizona. But we welcome all of you in as we do that. I love to hear where you're watching from. So many of you have reached out, especially even in the last 24 hours, strangely enough, to say that you're watching from other places, but it's helpful for you to plug this data in your particular area as well. So we welcome you to this, even though we really focus on Arizona-based numbers. And that's where we start each and every day. Let's jump right in. Again, we're not here to make decisions for your life, but we know that you have so many decisions to make on safety and health. And you know your friends, your family, your life best. You make the decisions. We help you find the data. So if you've got a question about some number you're trying to find, post it in the comments. We'll help you find that number. But Garrett, we start as we always do on that summary page today, which gives us a look at how things are in the last 24 hours as the reporting comes in here in Arizona. These numbers aren't just from the last 24 hours, but they're reported in the last 24 hours. And finally, and good news, we'll start with that, another day under 1,000 people, 1,000 new cases reported.
Yes, exactly. We are at 637 cases reported today. 105 deaths were also reported today. To give people who may be just joining us for the first time, this is not in the last 24 hours type report. This is 105 people and those 637 cases that happened over the course of time, especially that death number. That's a death number that's probably, realistically, about a third of it comes from the last 7 days. Another third comes from 7 to 14 days, and the rest of the remainder comes from the rest of July. So just to give you some context on that death number, we had about 7,200 PCR tests and about 798 serology tests. That gives us some pretty decent percent positive calculations for the day. Our percent positives for today were for 9% on the reported PCRs, 7.9 on the when you consider the serology tests, and then under 5% if you take the electronically reported tests. So all in all, the percent positives were very good numbers today.
You talk about the electronically reported tests, and that's been a bigger conversation in the last 24 hours as people learn a little bit more about how things are reported in. Some of the numbers come in via fax, and there's been conversation about how soon and how quickly the Arizona Department of Health needs to add those in, whether it's hiring separate people that are just focused on data entry to get that information in. The electronically reported numbers get us the data the fastest.
Yes, and when you look at them now, a bunch of media outlets have done a report on, as to asking the AZDHS as to why there are some labs that electronically report and some that do not. And really, one of the answers to this, and the answer they gave, and I can sort of vouch for since I've worked in government, is that the IT product to basically get a laboratory hooked into the system is about a 30-day project, and it's extremely expensive. So that's one of the reasons why you see places like Sonora Quest and LabCorp and ASU are all hooked into the IT, the ELR system. But a smaller lab that's outside of Arizona who doesn't typically work with the AZDHS, they would have an onboarding process that would be very complex. In the last, I believe in the last press conference, or at least presser, Dr. Chris said that they are working to. This was an answer to one of our questions to one of our reporters. They said that they are working to online onboard as many of those laboratories as possible in the next month. They should have most of them done, and that's going to sort of belay this fear on these electronic reported tests. But yeah, it's a very complex process, and especially with the out-of-state labs, it takes them a while to get onto it.
A lot of people are already asking about opening up the gyms. We can tell you an update on that. Many gyms have put in an application to be able to reopen, and part of that is attesting to the safety guidelines that they agree to follow, not only for their staff, but for their clientele, to make sure that they can keep everybody safe when they're inside of their gym. We're hearing from more gyms, I would say by the hour, that are adding on to that list that are getting approved to open up. I know many of you who are members at a gym are getting an email from your gym saying that they've got the go ahead and that you should expect to wait just a few more days or hours till they can get their staff in place to get everybody back. So things are starting to open up as far as the gyms go, and also the movie theaters. Those are a few of the updates that we have. I don't have a complete list of everyone that's been approved because it's changing so fast. So check with your particular site if you're waiting for your gym to reopen. Hopefully they've already applied to be able to reopen, because that's one of the first steps, and that if they're good communicators, they've communicated that with you as a client there. So Azra, I hope I'm saying your name right. She's asking about movie theaters. That's in the same boat. Some of the movie theaters have already been approved, and some others are saying there are no movies being released anyway, so we're waiting until we actually have content to share. Can you believe that's part of the problem in all of this? So it just depends on your particular theater. It depends on your particular gym. So be sure to check with them as they start to update their situation. Garrett, we always talk about the R naught number and going to RT Live. There's a bit of a change. And you're saying nothing to be alarmed about too soon. Obviously, we're going to keep watching it. But we did have a massive dump of cases that came in, and that can skew the numbers just a little bit. We are not in first place any longer. I believe we're like in third as far as that goes. We always look at our range. And I had a special request to talk about this today, coming all the way from Minnesota. So if we can touch on Minnesota's numbers as well for...
Sure.
Our viewer, Bert, who is watching. I did peek Minnesota's way up in the red, so we'll talk about that. But first, Bert, hang on, and we will get to Arizona here with Garrett. I believe we're in third place now, Garrett, if you will.
Yes. Let's see. I was trying to darken the screen, but for some reason it won't darken. So we're
okay.
Unfortunately not going to be able to do that. But here is Arizona. You can see that we had the lowest rate of transmission for quite some time, but we have popped up a little bit to a 0.84. We're touching the 1 now on our error bar. We're no longer under the 1. It's now 0.64 to 1. That has a lot to do with some case dumps that came in the last couple days. We saw, and this has a lot to do with exactly this electronic reporting system we're talking about. We've seen in the last couple days, AZDHS has done some data entry catch up and actually did add some positive cases that came, and they came throughout the entire curve, which increased our percent positivity by a substantial amount for that one day. And so this is what's sort of probably most driving of this number going up. We'll see what happens in the next couple days, but this is sort of, I'd say, a hiccup right now because of what happened a couple days ago. So we're sort of waiting as they onboard these ELR systems and they get through their data entry. That might be something that doesn't happen as much, and we'll see. Let's go to Minnesota, right? Minnesota?
Yeah, that was it.
Well, Minnesota is the fourth, has the fourth highest rate of transmission in the country right now, 1.15. Their range is 0.87 to 1.36.
So thank you for highlighting that in particular. I know so many of you watching from other places have accessed this site as well as a spot to get information in your particular area. RT Live. There's Bert writing on pins and needles. What's happening here in Minnesota? Nobody talks about the R naught here, and they look at me like I'm crazy. Well, that's why, Burton, we're so glad you're joining us on here, because we love to teach people about all of this information that's coming out so that everybody can best understand it and take it to other areas of the country, like one of my favorite states, Minnesota. So hopefully that helps. Thanks for joining us all the way from Minnesota on here as well. And Garrett, when will you feel more comfortable about this leveling out? If you still look at this on Monday and we're kind of peaking up a little bit, will then you be a bit more concerned, or do you think we should even hold out longer? When we're
the hard thing is, because we don't really have a good idea of where they are in the data entry process at AZDHS, it's really hard to tell. It's one of those things where, if, like today, for example, I didn't see no amount of, there was no massive case dump, or not, I don't want to say massive, that's not fair. Yeah. There's no case dump that occurred past sort of a 2-week period today. So if I'm not concerned about the rate of transmission over time, as long as those sort of case dumps don't happen. If the case dumps do happen, it is going to push up our percent positive for a day, which is then going to cause the wiggling of the rate of transmission. So, I mean, that is, of course, just based on, this data entry and this electronic reporting issue at the AZDHS. Of course, if we start to see an increase in cases or deaths or hospitalizations or especially emergency room visits, then, that's something where we have to watch and be like, wow, this could be coming. And it could be sort of I don't want to say second wave, but it could sort of say, it could push things up. Right now, nothing like that to suggest that things are being pushed up. They said we actually, Dr. Sonnenschein in the press conference, she's the director of Maricopa County Health. She just did a press conference and talked about how the case numbers in the test the low case numbers is not from low testing, simply because the hospitalization numbers have gone down too. They would always say, look, even if the case numbers and the test numbers are completely tied to each other, the hospitalizations are not. And if we started to see hospitalizations go up again, even if the case numbers go down, that's still an indication that there may be community spread.
So on those numbers, most hospitalization numbers have still been trending down and headed in the right direction, obviously. But we are watching those ER numbers.
We are seeing a slowing of the hospitalizations, and actually, this is a good day to introduce there actually was an update to the dashboard today. So I've got it shared. And what they did was they finally sort of brought their dashboard, as long as it works, to what the governor has been using in his press conferences for quite some time. Hopefully this works. Let's try it one more time. And I'll give it one more time just in case. I'm going to pull off I'm going to stop sharing screen for a moment.
Okay.
So I can pull it into a different browser just in case there's something wrong with the browser. So just give me a moment.
Brian is asking about the restaurants and bars and clubs, and I can address that as you're pulling up that site. Brian, we will get a really good update coming tomorrow. Obviously, Thursday's the day that they sort of put out their number to recalculate things and give places the go-ahead. I want to say that a handful of bars and restaurants also applied, just like the gyms did. I don't have a complete list of that. I wonder, producer Josh, I don't know if you, I know you can hear us on here. I don't know if you have any more information on the bars and restaurants, if any of them have gotten a go-ahead on that. But I know that they were obviously very concerned about being able to open at least to the percentages that were allowed. So as I learn more information, let's see. We've got a list of them on abc15.com. So producer Josh is all over it, and he is on that beat, and he covers all of the entertainment and restaurant life and all of it for our station. And he's got a ton of information on our Facebook page. So go to abc15.com. There are 600 total businesses. So that includes everybody, gyms, movie theaters, everybody that has applied. 38 so far have been approved. 6 have actually been denied, and the others are all in the process of learning a little bit more. So that's the best place to kind of get an update on that. And then, of course, as I mentioned, we will update you tomorrow as we sort of get the exact number that the state's calling it for the week, and that comes on Thursday. Were you able to get that to load, Garrett?
Unfortunately, no, but I do have the regular hospitalization numbers from COVID-19, so we'll use that. There was an update on the dashboard, but it seems to be not working. I saw someone in our comment section said, oh, yeah, I went there and it didn't work as well. So we're just going to use the original, and then hopefully by tomorrow we can show you the new update on the hospitalizations page. But here we'll just stick with the COVID-19 specific metrics. You can see this is the inpatient acute care beds. This is what we talked about. We're starting to see a slowing of the basically a deceleration of the curve. It was going down at a very consistent trend, and you can see right here for the past 4 days now. The 3 days now or so, this is starting to bend. Which means what that means to me is that we're going to start seeing a slowing of the cases as well. We're starting to see this everywhere. Things are not going up. That doesn't mean they're going to start going up anytime soon. We just don't know. But what we do know is these hospitalization numbers are starting to slow down their decreases. They're just not going to be decreasing at the same levels. Same thing with pretty much everywhere. You can see ventilators, which are going to lag inpatient. So we might see a difference in a couple days, but you can see small decreases in ventilators for the last couple days. ICU, we've already seen the decrease or the deceleration of the decrease here. It's just not going down as fast. That's going to be because, again, more people are staying in the hospital for longer periods of time. And then the discharge number's gone down a pretty good amount today. The emergency room, you can see this one hasn't gone down this week, really. If you look at the trend, it's kind of almost leveled out. So next week's going to be very important for emergency room visits. We'll see if this maintains sort of a level nature or whatever direction it goes in, but it definitely has slowed down its deceleration more than any of the others. And then intubations, a noisy graph again, but again, you can see the curve is sort of slowed down as well. So basically all of these drops in hospitalization assets, and I'll answer that question in a minute. Those drops in hospitalization assets, they've all started, they were for 3-4 weeks now, they've been dropping like a rock, and now they're sort of getting to what is possibly a floor for a while. It's going to decelerate at a lower level. As far as the percent of hospital resources, that was the page I was going to take you to, and it's not working, but I can tell you that the hospitals are right now maintaining levels of about 80%. And that seems to be a level that they want to maintain, because what they're doing is, as these COVID-19 numbers have dropped off, they've been adding their elective surgeries that needed to be done and everything else. So they're maintaining an 80% level, but just replacing the COVID-19 patients with others.
So Eddie writes, again, deaths with COVID and other factors versus deaths strictly from COVID itself. There's your question. Answer that. I dare you. Show true numbers of COVID deaths, period. So Eddie, one of the things is you're not getting a COVID diagnosis and then just falling dead. You're not dying from the COVID diagnosis. You're dying from all the other things that are happening to your body when COVID is attacking it as well. So for instance, 3 things could be listed on your death certificate: an acute respiratory illness, then pneumonia, and then COVID. So all of it would be listed right there. It's not you get a piece of paper that says you have COVID and then that's it. So all 3 of those things will be listed on there. And in fact, Garrett, they really talked a little bit more about this in relation to something we have talked about over the summer here, which is the increase in number of deaths from 2019 to 2020. And when I say they have talked about it, just within the last hour, the county was updating everybody again on the difference in numbers in deaths from 2019 to 2020. Now, here's why that's important, because if we have a whole group of numbers that is so much higher than last summer, we would know that that is not part of what is expected. So it is not part of the normal rate at which we see death here in Arizona or in Maricopa County. So then how are those deaths classified, and how do they look back at those particular cases to try to better understand what happened there? And this is a process, Garrett, that can take many, many months as they investigate why this person passed away. But we are looking at a lot more deaths. Now, for those of you not watching from Arizona, you may not know, obviously you know it's hot in Arizona, obviously you know it's summer, but you may not know this has been the hottest summer on record. We are dealing with temperatures of over 110 degrees, 115 degrees for more than 40 days in some cases. So we are in it, and it is a huge factor in deaths as well. So they'll look into whether these other deaths, this other highlight in deaths is from heat, is from COVID, is from other situations. And we do some things other places don't do, Garrett. When somebody dies alone I shouldn't say alone, but dies at home, alone as in not in a hospital, not with care right there with them. But when they die at home, Arizona does a little bit more to investigate the death.
Yeah, Dr. Sonnenschein just said that on her, when we actually asked her this question, she did say that on these, the first step, of course, is the death certificate. If the death certificate says COVID-19 anywhere on the death certificate because the attendant physician put it there, then it would be counted as a COVID-19 death. They said that they go further. In fact, they do testing. If someone dies alone from a lower respiratory, if they die in their house from an upper respiratory disease, they will do post-mortem testing to see if it was a COVID-19 death. They also do COVID-19 hospitalization tests, of course. If someone goes to a hospital, they will test them. And if they have COVID-19, and again, this is all based on the attendant physician. People think that if someone dies, I saw someone say in the comments, well, if they die of a heart attack, they're going to be counted as COVID-19. Well, that's only true if the attendant physician believes that they died from COVID-19 and that it was a contributing factor. It can absolutely happen, but the attendant physician has to do that. And please remember that attendant physicians are putting their license on the line if they upcode to give a hospital extra money. So they're not just going to sit there and haphazardly put COVID-19 on a death certificate for the benefit of a hospital just to inflate the numbers. That's not going to happen. Now, we do have some numbers from the AZDHS. I have them shared on a spreadsheet. It's a little, obviously it's a spreadsheet, so it's a little ugly, but I try to make it as big as possible. Here's Arizona. You can see these are directly from the AZDHS. You can get these from the vital statistic pages. So what I did was, you can see 2020, and you can see right here, January, the percentage between 2020 and 2019 was a 2% increase. Then we saw a 12% increase. Then we saw a 7% increase. All within sort of the margin to be expected, if you will, for January, February, March. And then April 14, large but not significant, another 14 in May, and then you get to June, and Arizona has a 37% increase in deaths. And then you get to July, and it's a 61% from July to July. Again, 61% increase in deaths from July 2019 to July 2020. That cannot be explained by population growth. In fact, here's the COVID-19 numbers for Arizona that are verified on the curve: 2,107 deaths in July of 2019. So this is the excess between the two, which means there's a difference of 874. So that's the question. All right, we know that these at least are in the process of being verified by medical examiners, but these, we don't know about these yet. There's still 874 deaths that we simply do not know if they came from COVID-19 yet or from other contributing factors. We just don't know.
And 874 cases to look into. We're not going to get the answers fast. This isn't what would you call it, like a CSI or whatever those shows are called, where they solve the case in an evening and by 9 p.m. what it looks like. So this is going to take months to try to decipher this.
Months. It's going to take months. But as Dr. Sonnenschein said, of course, there are situations in which, COVID-19 could be a contributing factor to some of these deaths. They just don't know yet. This is, we've said, Dr. Chris did say in a press release that she believes that suicides have increased and some other things. We don't have any data on that yet, so I don't know if it's true, but this is what Dr. Chris said. We have these, like I said, these 770 deaths in excess and 874 in excess in June and July that we simply do not have answers for yet. And again, we're not expecting answers for these anytime soon. These are numbers that have to go through a very standardized process. It takes them a long time to get through. So they don't even release on it. I was looking through the AZDHS vital statistics, and they don't even release cause of death information till about a year or two after it's occurred. So, I mean, the most recent data we have from the vital statistics page is from 2018 that really breaks down what all the deaths in Arizona. So as you can, like what I'm saying is, it's going to take a while to get these numbers through. We're going to have to rely on CDC national health statistics for a while until we get a handle of things here.
Yeah, it's like, look how long toxicology tests take. Yeah. I mean, it takes a long time to get answers. And that's one of the reasons that epidemiologists shy so far away from the case fatality ratio or the mortality rate, because we're still in the middle of this. It's hard to assess the numbers when we're right there in the middle of this pandemic, this whole situation. Kimberly writes, there's multiple places for cause of death on a death certificate too. Exactly my point, Kimberly. Yeah, as well as spaces for comorbidities and co-conditions. So they're able, you don't just have one line to put all the information in. So I think therein lies the confusion, is that people don't necessarily go about their lives seeing death certificates, thankfully, all the time. And because of that, they don't understand that there are multiple lines to be filled in there to categorize a death. It's not just one case.
Yeah, and who is that? Kira Brianna. I'm sorry, I will entirely disagree with what you're saying. Okay, we've done a. She says that we all know it's a lie because nurses and doctors trying to market individual health issues, COVID-19, which makes the stats higher and they get paid double. Yeah. This is just not true. They do that is not the case. We've talked to doctors about this. We've looked at the numbers. What we can tell you, based off of myth busting, and this myth busting report we did, is that yes, it is true that COVID-19 treatments get additional funding. This comes from the Federal Care Act, but there is no extra funding to mark a death on a death certificate as COVID-19. In fact, you are putting your license in jeopardy by doing that. If you upcode just to get the money, and it goes through a very long step process. The attendant physician is not the only one that looks at this data. So if all of a sudden they've got all this, if the Office of Inspector General has all this data that looks like there's upcoding going on, somebody is going to have their license in jeopardy. And someone who goes, does it happen? I'm sure it happens, but it's an outlier. You're not going to have multiple nurses and doctors, especially people who are going to school for 5, 6, 7, 8 extra years, putting this on when they have no financial incentive. They're not going to mark a death just to make the numbers higher. And what I just shared on my spreadsheet, the deaths are higher. You cannot argue with the fact that the deaths are higher. There is a 61% increase in July. Whether that comes from COVID or not, we don't know yet with those 874, but you cannot argue with the fact that there is 61% more deaths. That is a hard and true fact. It's right there. Will it change after a while? Of course, it'll change a little bit, but it's still not going to go back down to 49.22.
Yep, exactly. They're not the ones getting paid. It's not like
they're not getting paid. Can the hospital get more money for it from CMS on an uninsured patient? I mean, yeah, a hospital will get more money to treat an uninsured patient or a Medicare patient with COVID-19, but there has to be treatment codes on there. You can't just have a death code that says COVID-19, and then someone goes in and said, well, where's all the treatment codes? This person just randomly died from COVID-19, but you don't have anything that indicates that they had COVID-19.
Yeah.
Well, maybe, you know what I mean? It's just, it doesn't work like that.
Right. Yeah, exactly. Anastasia's backing you up as well. Don't insult me by saying I'd risk my RN license to mark COVID down. It makes
thank you, Anastasia.
No difference to me nor the doctor. And Anastasia is an RN, so we thank you for joining us on here for that. So there's a lot to look into for the numbers here in Maricopa County and this massive increase. And of course, they even said, are we counting every single COVID death? We're probably not.
No, there's obviously going to be some. We've seen it before. There's a step process with these death certificates. It takes a long time. We've talked about it here, that how in health departments in the sort of the health world, they're not used to doing real-time statistics in health. This is basically a brand new world for them. They're trying to get this as right as they can, but it takes them typically months and months and months. Most of them are used to basically putting something out once a year, maybe once every 6 months, or once, in the case of the provisional statistics, once every month. But they go through it and things change because they're provisional, and then they pull out, okay, we're much more confident about these numbers once a year, essentially. And we're asking to do it every single day. So yeah, will the numbers change? Yeah, they'll change. But, we're still, like I said, 7,903 deaths. We know that that's an excess. That's just the way it is.
Yeah, a big excess. And we think of those families as well. So often we're on here talking about the numbers, and I always want to pause to say we're remembering the families behind all of these numbers as well. My gosh, we passed 172,000 deaths here in the United States. That's 172,000 families that are grieving through the middle of a pandemic. So many were not allowed to go say goodbye in person. I don't know if any of you have ever had to say goodbye to someone you love over the phone. You will never forget it. You will never forget it. That is for sure. So 172 families in the middle of this, dealing with this, grieving this in the middle of a pandemic. We've had, as we mentioned, 4,634 deaths here in Arizona. As we talk about all this, of course, the conversation surrounds schools as well, and the concern about going back to school. ASU is going back tomorrow. We've seen so many colleges now start to have to pull back for their in-person learning and make changes. We, of course, want to let you know that we will have complete coverage on what's happening at ASU tomorrow as these in-person classes resume, and the safety measures that are in place. As we've told you on here, they tested those kids at ASU to be able to get them to come back to move into the dorms, and that they still have that testing that's going on. That is the saliva testing. And Garrett, I think there was even one this morning. Today's Wednesday, right? All my days are running together. I believe there was one this morning over at maybe even Sun Devil Stadium. Is it even called that anymore at this point? in Tempe that they were testing. They were testing out at Cardinal Stadium, and they were doing that. They're still doing that on Tuesdays and Saturdays. It's so easy to sign up for that test if you want to go get tested out there. The demand has been lower, so the lines are shorter. You can get in there quicker. Sign up at doineedacovid19test.com. You're going to be able to sign up either for the swab test or the saliva test. The saliva one's the one I did. It's so easy. You drive through, take a few minutes to fill the cylinder, turn it back in, and you get your results within 48 hours. So it's a really, really easy way to go. Valinda's saying it took me 22 days to get my test back. Yeah, we had major testing lags before. Those are caught up. Do we know where they are now, Garrett? They're like at 3 or 4 days. Really.
Oh, yeah, there's no real testing lag at this point. It hasn't been over. Like I said, the one day that it was over 7 was that day that I'm talking about where there was that massive case dump. And it was at like 16, but it wasn't a real lag. It was, like I said, just this strange sort of case dump that happened. So, no, there hasn't been a lag. And then I wanted to answer a question. Alina asked about the facts. It was something about the facts. Are they being counted? Is it true about the numbers, the tests not being faxed? All right, there it is. Is it true fax positive and negative results are sent in and not being counted? What I can tell you is that there are labs that are being faxed, that are faxing them in. Almost all of those positives are counted. We have seen them have to try to catch up to a couple every once in a while. The negatives, though, they're just starting to get to counting those. So for the longest time, they have not been counting those.
Yeah. Michael writes, are you sick? Then no, you don't need a test. Actually, Michael, we have enough tests now that if you're curious, you can get a test. You don't have to wait till you're sick anymore. If you're curious, you can go take a test, or if maybe you want to see a loved one who's older or has a compromised immune system, you can go get a test. And Felicia writes, it took my friend 2+ weeks. I cannot imagine, Felicia, waiting that long. I know so many people, so many stories we did on people who did have to wait that long. That part's over now. You can go get a test and get answers within like 48 to 72 hours. So you can get it really quick now. But that was the case for a long time. And Garrett, I mean, waiting those couple of days was so nerve-wracking. I can't imagine what people experienced early this summer when it was like 2 and 3 weeks. Just unbelievable.
I know.
Okay, Candace is asking a question. She can't find the website that we shared about a month ago on here with the COVID-19 charts that were by state and county overlapped on top of one another. I thought I saved it from you guys. Can't find it. Can you reshare the website?
State and county.
I'm trying to think, Candace, which one that would be.
I have the state and county, huh? Oh, you know what I bet it is? Hold on one second. Just give me a second. I bet I know what she's talking about.
Okay. And Candace, stay on here with us so we can make sure in the comments that you're getting exactly what you need. Oh, Kylene, I hope I'm saying your name right. Very pretty spelling, very pretty name. Says she got all 3 of her tests back within 15 minutes. That's incredible.
Nice.
There are rapid tests out there, but I hadn't heard of anything that fast. That is wild.
Okay, I think this is the map they're talking about. We haven't gone to it in about a month, so that sort of makes sense to me. This is the COVID-19 Risk Assessment Planning Tool by Georgia Tech. This is basically what they do here is they're modeling out, and I've got it shared, ready to go. They're modeling out by county and state how many people in an event size, what's the probability that someone in that event has or has had COVID-19. So right now we've got it set to 100 people of event size, and you can see in Maricopa County, this used to easily be 99% when we used to look at it. Right now it's an 86% probability that someone has had COVID-19 in that size of an event. Probably at 500, it's going to go back to, see, it's back at for that size. But if like for an event of 25, for example, you can see that they think that about 38% chance in an event of 25 people that someone has had COVID-19. So this, I think, is what you're talking about, because this sort of gives us the idea based on anywhere in the country, really. You can look at any county. This is not just an Arizona thing, and sort of get a idea of what the probability is of how, at an event you go to, what's the probability of someone who has had COVID-19.
Mm-hmm. That is such an interesting site, because I know people, are being asked to travel maybe for weddings or go to other family events, and they're wondering if it's safe. So many people have asked about the size of the group. What is the lightest area in our state? Is that, I can barely see on your map there.
Greenlee?
Is that the lightest one? The
Yes.
lightest story?
Yeah.
Wow.
Greenlee has not had any case growth in months, but there's also only about 10,000 people in Greenlee. So they're always. I mean, I don't want to say months. Probably in several weeks they haven't had it. When everywhere else was having an increase, Greenlee barely moved.
Yeah.
So very very low rates of transmission there. I think right now, if you look at their recovery numbers or what they say is their recovery numbers, I think 10 people have positive COVID-19 at this very moment in that county.
Mm-hmm. Wow. Jim writes, thank you both again. One of the few sources I trust. Jim, thank you for joining us on here. We're just here to teach and here to show people the information that's coming out of the state of Arizona. We believe that you all know your lives and your health better than anybody, and you can make decisions for your life, but that we can help you find that information wherever it's buried on whatever website we have found it. We've been staring at these websites for months and months and months and can maneuver our way through them a little bit faster and spare you some time in your day. So that's why we're doing this. Andrea writes, what's our not number? If you mentioned it already. Yep, we did mention it. Just scroll back. It's at 0.84 today, but we are
at 0.84 right now. We're still under 1, but we moved up a little bit. But my presumption right now is it's a hiccup, a reporting hiccup, and we should go back down, but we'll see what happens in the next couple of days.
Yeah, so roll back if you want to hear us chat about that a little bit more.
Susan asked about how many deaths today are death certificate matching, I think what she means. Yeah. And that answer, it appears, they didn't say anything, but just based on the numbers we've seen, about 60% of the deaths came from matching today because they were more than 2 weeks old. So that's what I can tell you on that.
So 105 new deaths added.
105 new reported deaths, but only 30% of them came from the last 7 days.
Yeah, and 85 of those are in Maricopa County.
Yeah.
So.
Mm-hmm.
All right. Do we have any update on the prisons? Jody's asking in Pinal County. Oh, your comment just ran off my screen. Where to go? In Pinal County, do we know how many of the numbers are inside prisons?
Oh, let's see. I haven't looked at that. Let me see if I can get to that dashboard really quick. I don't track it that often. I'm kind of terrible about that dashboard, so I do apologize for that.
Yeah, that had been a major concern, and it is one of the things. Oh, Susan says thank you. Susan, you're welcome. Thanks for joining us on here. Thanks for taking time with us today. Yeah, the prisons had been of a big concern here in Arizona, of course, because it's such close quarters. So if one person gets sick, or there is a guard or a staff member that's out in the community, whichever direction this virus is spreading, it's a danger to not only those who are inside the prison, those who are outside of the prison as well. So it's a community issue that affects everyone. So it's one of the reasons we had been tracking that. We have lots of reporting on prison systems here in Arizona on our abc15.com website.
So I've got it ready to go. Let me just check to see what Pinal's number is right now. Pinal's number right now is 89,000, or not 89,000, 8,900. Sorry about that. And let's just go through there. I'm just going to double confirm, make sure I have the right one. Yeah, 8,900. And then, so I've got pulled up the Department of Corrections dashboard. I'm going to send the link to producer Josh just in case he doesn't have it. I don't remember if he has it. And then what we got here is all of the prisons that are managed by the Department of Corrections. And then you have all these numbers here, which tell what their inmates confirmed number as well as the staff. And you see this was updated on the 18th. But let's just go right over to Pinal County. Let's see, here's the complex right here. You can see that inmates confirmed 45 in Central Arizona Correctional, and then Florence West only 0. There's 0 in Florence West, and then 100 in this is Florence itself. So, and then here over in Iman, only 74. So not that many from at least the Department of Corrections are coming from the prisons. It could be, there's obviously some of these others. I don't know if the private prisons are on here. I'd have to really look at this, but that's what it doesn't appear that a whole lot of the spread in Pinal County is coming from the prisons.
Ingrid writes, thank you for addressing some of the myths about COVID. I found it so ridiculous that some people are insisting on believing and spreading some of these TV drama fantasies they hear or manufacture. I don't know what has to happen to get some of these reality show addicts moved into the realm of life reality. Thank you for your in-depth reporting, Ingrid. Thank you. That's one of the things, busting all the myths surrounding this, because it's so insulting to our frontline workers who are working so hard to save lives all day, and then coming home and maybe taking a few minutes to get on social media just to decompress and reading crazy conspiracy theories out there that are so unfair to the real life work that they're doing.
Look, and to be fair, I know that that's a myth that comes sort of from the sort of right side of things. But, to be fair, there's a myth that resonates on the left side of things that, the data is being manipulated by the HHS. And that's also not the case. That doesn't happen. We've talked about this before. We see the data before Health and Human Services sees it. So there's not a HHS employee standing in behind the EPIs at AZDHS saying, oh, you better make this look better. That's just not how it works. We're seeing the data long before HHS gets anything to do with it.
Well, and to perpetuate a conspiracy theory, they would have to have epidemiologists in every single county.
Yes.
You know how many counties there are in the United States, all working together in some sort of wild system. So, boy, okay, lots to discuss here today. We only have a few minutes left. We're already, we already are at 40 minutes. So good to talk about all of these things and continue talking about it. But I want to let you know about a few things that are coming up. I can hear my kids screaming in the other room, and they're goofing around, and Dad's out there watching them. And I say that to tell you that I know everybody's been hanging inside in this heat too much for too long. So I want to let you know of some resources that are coming to you tomorrow to maybe get your kids out or get them virtually distracted online with some events. Your family as well. Say you don't have kids, we got you covered. It is things to do here in Arizona. There is a town hall coming up tomorrow afternoon right here on this very same format. So go to ABC 15's Facebook page, and they're going to have all kinds of things to do. Virtual stuff. They're going to have things in person, but let you know the safety measures that places are taking so that you can make a choice whether you feel safe participating in it or if you want to do some of the things to do that they're presenting that are virtual. Obviously, safety is the number one topic, but we're adding entertainment into it as well. You can catch that at noon tomorrow. The Office of Tourism is going to be on there. Parenting Magazine. Josh, who we've talked about, who is our producer here on this, is also just knows everything about restaurants and entertainment here in Arizona, so he can help walk you through some of the things that will keep you guys busy through this last little bit. I keep thinking, man, if we can make it, Garrett, through like one more month of this heat, we're going to be in such better shape. The kids can go outside earlier instead of at 7 p.m. I mean, I cannot keep them. You can hear them screaming in the other room, I'm sure. That you cannot keep them occupied enough to keep them distracted. How's your daughter doing through all this?
Oh, she's doing great. She's doing kindergarten. It's the first year of school, and she's learning how to use a keyboard, which I didn't think I'd be teaching my kid how to use a keyboard when they're barely learning how to do their ABCs. But
I know. I had to buy something I've never purchased in my life, which is a stylus, so that they can actually, my kindergartner can actually practice letters with something in her hand instead of hunting and pecking to learn.
Hunting and pecking.
Letters. All right, so join that conversation tomorrow at noon. We'll, of course, be back here with you around this same time in the early afternoon to talk about all of the Arizona-based numbers. I will let you know, we hope that we'll get some information out of the county, a little bit more information about the big Thursday reveal and how things rank. You all get a little bit of an insight right here by joining us each afternoon, but you can also, join us for that, and we'll talk through all the information coming out of both the county and state. We want to thank you for taking time with us here this afternoon, and we'll be back here tomorrow. We want to remind you ASU starts tomorrow as well. We'll be talking about that. And remember, our newscasts come up this evening at 4, 5, 6, and 10 p.m. I hope you'll join me over there for those as well. And remember, all the very latest coronavirus reporting at abc15.com/coronavirus. You can find Garrett at Garrett_Archer on Twitter. I'm on Twitter as well at Katie Raml. And let's see. Oh, on Facebook as well. You can catch me on Facebook at facebook.com/news from Katie. All right. Oh, somebody's asking about the big decline in positivity rates. We've been wearing masks here. We shut down some businesses and made some big changes. So I think that's probably made the biggest
And we were already, yeah, we talked about this particular thing. It's not, the CDC and the HHS has no bearing or weight on what our positivity rate is. We would see there's other means that we would have seen. We would have seen hospital changes. We would have seen the CLI go up. There's so many other things that can indicate an increase in these numbers that have nothing to do with the case counts or the positivity rate.
Joseph Hoffman will leave with his comment. He writes, "Thank you. Love the data-driven discussion. Thanks to all of you for joining us on here. We'll hopefully see you back here tomorrow."